how do we help people understand the trusting of the data and learning through, obviously, as it matures, whether it's Alexa or Siri, right? Maturing through its own development to a place where the healthcare industry actually trusts what technology is augmenting what they're doing versus replacing in any way.
Right. I think it starts a little bit with the marketing. It's actually very important not to overhype and overpromise and say, oh, we're going to just replace all of radiology. That will not happen. There's so many diseases that are very infrequent. And AI is only good right now, the state-of-the-art AI algorithms are only good at things that they've seen a lot of times. And so by definition, you have sort of a power law. You have some diseases that are very common, and AI will be very good at understanding the patterns and improving care on those very common diseases. But there's a long tail, heavy tail of diseases that are not very frequent, and it's more and more important for doctors to be able to figure out what those are. So I think it starts with the marketing, the trust. And then, of course, the whole data, it has to be in a very secure place, right? Nobody wants to have their medical records be leaked somewhere. So it's very important that you invest a lot in security and have a very trusted platform. That's why our trust is our number one value at Salesforce too, because we understand that very deeply. And nowadays cloud is relatively common, but when Salesforce started many years ago, that was a big factor that Salesforce sort of was able to push. So, you got the marketing, you have trust, and then I think the third thing is as you expose people to the outputs of AI, you need to very carefully think about how you present the results from the predictions. So you only want to show things that you're actually confident about, not show low confidence predictions. You can have different kinds of algorithms that actually give you confidence bounds and estimates of how certain they are about a certain result, and then also try to make it explainable, where you actually say, I'm making this prediction and this call because of these factors. So the doctors who have a global view and may have access to data that isn't directly in. They look at the patient, and yes, there's a digital medical record, but they see the patient right there, and there's something that didn't add up. Maybe something is missing from the record, so they can integrate all of those predictions together. And then the fourth and last one, I would say, that is quite important is to understand that AI algorithms are only as good as the data that they fed in and that they get fed. And then because of that, they may have biases that people might not have known. So maybe you have a certain population in your hospital of mostly people from this ethnicity, with this economic background and so on, and now you make certain predictions based on that training data alone. And so if people are outside of that training data, your AI might not be as confident and shouldn't be as confident. So understanding the biases that are being fed into the AI algorithms through the data is a very important and still active area of research.
The other thing I'd like to add to that is you asked a question mostly about the diagnostic and the treatment. Right. How are you going to cure something? And in imaging, there's this diagnostic question. And there's something amazing about those questions and those technologies, and we're all excited, and I think we're all eager to sort of see all of that. But what's a little more prosaic, and I would argue even more important, is how do you manage people over time? We know we spend about 80% of all healthcare spending in this country on chronic disease, which means it's diagnosed once, and then people live with that disease for sometimes decades. And how do you manage someone in the inevitable worsening of a lot of diseases? How do you make sure that they know how to take their medication? How do you answer their questions? How do you know when someone might have a propensity to miss a surgery, which creates all kinds of havoc in a hospital, or when someone might miss an appointment or not fill their medications or all kinds of things like that. I think that is some of the, maybe I'm a family doc too, so I have my own bias, but that's the kind of stuff where I think we're going to see a great deal of benefit, a great deal of improvement in care in our own experiences, and frankly, better outcomes and better costs.
So I'm going to pivot. And the need for that in terms of staying engaged with patients that are going through chronic disease, that will fuel the adoption of wearable technologies. That will fuel chatbots and how we deliver customer service and care. That will fuel, today we see conversational commerce where you can purchase using natural language processing and voice as potentially the next UI. You can see that with virtual healthcare assistants. So life coaches, you have healthcare institutions that are providing services to patients after a treatment or diagnosis is made. So a lot of innovation that I actually see on the retail side of the industry being adopted by healthcare. and again, fueled by AI and powered by a CRM platform, including, again, and wearables.